A visit with your doctor is a good time to share health concerns and ask questions, but have you ever felt your physician's office and you got there and you realized that you forgot to ask an important question, or were you frustrated because you didn't understand the doctor's diagnosis or instructions? Well, Dr. Jamal Lawrence is the founder and CEO of Harvest Health MD. He's also double board certified in both family medicine and lifestyle medicine. He's also a male model. That's his side gig. He's here to help us get the most out of our doctor visit. Thank you so much for being here today.
Thank you, Ms. Gusby. Thank you for having me.
Well, first of all, you say that people should prepare, and each letter stands for something that you should do.
Yes.
Let's start with the P.
Absolutely. And so people need to prepare. And so long before your doctor's visit starts, you have to plan and make sure that you have all your ducks in a row. And it's as simple as knowing the date, the time, not getting them confused, making sure that you don't have any appointment conflicts. I can't tell you how many times a patient has showed up and it's like, my appointment's right now. No, sir, you're not on the schedule. That's actually tomorrow, or it's 2 hours from now.
Or it was yesterday.
Or it was, yeah, that's happened as well. And so, busy lives, there's a bunch of distractions, there's a lot of, tech that takes our time, family issues, lifing, so to speak. And so we just want to make sure that you clear the air and that you're really specific and you know what's coming, when to be there, when to show up, those kinds of things.
Because we know in a lot of doctors' offices, not yours because you do your practice a little different than everyone else, but once you miss that appointment, if you miss that appointment, it's hard to reschedule the next.
Yeah, the flexibility in my office was I actually had that happen to me this week where somebody showed up about an hour different, but because of the flexibility, I was able to give a few minutes and allow for them to still have a visit. And that actually ended up being a really important visit. But for a lot of people, they don't have that opportunity, they don't have that access.
Yeah.
And so it's really important that when you are able to get your visit and you have the availability, that you make the most out of it.
Yes. Next letter, R.
Absolutely. And so you want to review the practice materials.
Okay.
Make sure that you know the intake forms, if there's any that come before the visit, that you've completed them, that you understand the practice policies and procedures. Those things are really important when it comes to billing, when it comes to being charged, knowing what the practice is about, how they operate. And so making sure that you review that beforehand can sometimes cut down on your time in the exam room.
Yes,
Or
okay.
in the waiting room.
In the waiting room. Okay, E, ensure your records.
So I can't tell you how important this is.
Okay.
When people come in and they have not signed medical release forms, that a lot of the times delays the process. And so in my practice, we can get those things in advance, but even when we're sending these requests out to different facilities, it can take up to 30 days.
Yeah.
And people don't realize that. And so it's a lot more helpful for me as a physician to have your records before you walk in the door. I'm already starting to plan for you, looking at your previous diagnosis, making a medical plan, and then at the day of the visit, we can insert the additional things that you have directly addressing, but I have more of a background. And so it takes a really long time to get medical records. If you're in a major system, sometimes the system can share information with different specialties, so that is a benefit in a
But
major
sometimes
system.
that doesn't happen.
Sometimes that doesn't happen. And so we want to make sure that you sign the appropriate medical release from the practice you're coming from and having it sent to the practice you're going to make sure that your visit is streamlined and that they have all the information they need to support you.
And that includes x-rays and everything.
Exactly. Labs, imaging, x-rays, previous diagnoses, all those things help.
Okay, so we know the word is prepare, but P is prepare in the coming up next.
Yep. And so you want to prep for your visit. You want to make sure that you show up on time or 10 to 15 minutes early. Yeah. Too early can be an issue, but definitely showing up late always is an issue in terms of when you'll be able to be seen. You want to make sure that you start to, and we'll go this in the next bullet, but we want to make sure that you plan to get your medication list in order. That's a big thing.
That's something that a lot of people forget as well.
Your bag of meds. That's what we say in medicine. But you want to make sure you have an accurate medication list, something that is the most up to date. If you don't have a list, you want to make sure you bring all your medications with you. Can't tell you how many times patients have requested medications and they don't know the dosages, they don't know the names. It's the little yellow pill or the blue pill. I'm sorry, that doesn't help me.
I'm sorry. I'm one of those people. You're calling me out, Dr. Lawrence, but go ahead.
Yeah, so, the manufacturers make all kind of medications in all shapes and all colors. And so, people often try to identify it as that, and it really doesn't help the physician. a lot of the times. And so they even have little apps to help us look it up. But if you have your medications with us, it takes a significant burden off of trying to make sure that we have accurate information. So if you need refills, that we can do that for you. And then the other thing is their family history. So, you know, in my practice, I've had patients text mom, call mom right now, but you don't have that in a traditional visit. You have 10 to 15 minutes, maybe 30 if you're a new patient. You don't have time to get people on the phone and say, you know, that cancer diagnosis, what kind of cancer was it? So make sure that you ask the family history, that, you know, a week before, you call mom, you call dad, you call grandparents, you figure out, you know, what things they've been dealing with, what medications they're on, even if they don't tell you the diagnosis. If you know the medications, a lot of times we can work backwards to figure out what it is.
Okay, so the next letter is A, which stands for ask.
Ask, yes. It's uncomfortable to understand the amount of times people feel concerned or scared to ask their doctor a question.
Or embarrassed.
Or embarrassed, right? And so the exam room is supposed to be a safe place. It's supposed to be a place where you can be vulnerable. It's supposed to be a place where you can get the help you need. And we can't help you if we don't know what you need. And so you need to ask questions. Ask questions about things you don't understand. Ask about your health. Ask about things that you maybe have read and you were considering. And it's our job to give you the education, the information, and empower you to make the best decisions for your health.
Yeah, because if they don't ask and they don't tell you, then you're going to find out eventually.
well, I wish that were the case. But the reality is questions that people ask can often change how the entire exam goes and what our focus is, right? And so even within that ask, prioritizing your questions. At the beginning of the visit, a lot of the times we will set an agenda for that visit. And so that gives you opportunity to make sure that you ask the questions that you are really important to you and that we get to the things medically oriented that are going to help you. And so the doorknob question, when we're walking out and you have that really burning question you didn't ask at the beginning, might have changed the whole context of the visit and what we talked about. And so that's really important.
So we have about a minute left, so we're going to get to the R, respond and engage, and then the E, express and explain.
Yeah, and those actually go together.
Okay.
And so we want patients, you know, after you've heard the medical plan, respond, engage with your physician. Continue to ask questions about things that you don't understand, clarifying questions, and express what you understand your medical diagnosis to be, the next steps. You know, we like to use the teach-back method. Tell me what you think you've heard, because sometimes those signals can get crossed. And so we really want to take, you know, this acronym, these points, to make a holistic visit that gives you the most out of your visit. With only 10 to 15 minutes in an average medical visit, you really want to go in there targeted, focused, and making sure that you come out with the results that you need.
So finally, you have a CTA, and that's a call to action. You say your health journey is a partnership.
It is a partnership. It's with the model of shared decision making. And so we want to make sure that you are fully engaged with the healthcare process, that you partner with your medical professionals to provide the best medical outcome that respects your culture, your goals, your personal desires, and that is evidence-based and up to standard.
All right, Dr. Jamal Lawrence, thank you so much for joining us today. For more practical health advice, resources, and updates from Harvest Health MD, and to join their email list, again, the QR code that you see right there on your screen. You can find all of this information and see this interview again with Dr. Jamal Lawrence, aka the male model, again, anytime on our website by visiting WSAV.com/community corner as he poses in his seat.